So when we first started engaging with DrFirst, it was actually in our Cerner days. And what we were finding was, to the first point that Dr. Banas was describing, we couldn't find all of the medications in the medication history. So when we were sending out these queries to your big pharmacies, your Walgreens, your CVS, we were getting back a certain percentage of our queries, but we were finding that the smaller mom and pop shops, some of the DoD pharmacies weren't on this network. And so there could be some important medications that were prescribed at these other pharmacies, and we were not able to pull that into the medication history. And so I engaged with DrFirst to say, hey, looking to expand our query search. And so we started to actually look at building it into Cerner, but we thought, you know what, we're moving to Epic, let's focus on our Epic implementation. And really, what can we do with the Epic implementation? And I want to take medication history to the next step. So then we also realized the gap in the workflow was this manual process, and that they're called SIGs in the pharmacy world, but these SIGs are going and coming back from the pharmacy, and it would say 1 tablet twice daily for 30 days, right? But a lot of times that information was coming back, the semantics wasn't mapping directly, and so you'd actually have to do manual entry and type in 1 tablet twice daily for 30 days. And so that was having to fall on our nurses and our pharmacy techs that do the medication history in the inpatient space. So
those techs were actually doing the manual entry?
Yes, exactly. So they were doing the drop downs, a lot of clicks happening. And so I thought, let's go live with not just the additional search queries, but let's go live with that AI component.
Yes.
And so we call it Smart Processor. So basically, it looks to pull in these additional queries from all these other external sources, but then it maps it into these discrete fields. And so the Smart Processor does that inferring, and it actually maps it to these discrete fields. So it fills in the 1 tablet twice daily with 60 tabs, so that the nurses or pharmacy techs aren't having to do that manual entry, plus that additional search to these other external pharmacies, these mom and pop shops, and the Department of Defense pharmacies. And so we did some studies that at the 7-month go live, we did some studies with DrFirst. We had found that in that 7 months, we had received an additional 23,000 medications that would not have been inputted into our system without DrFirst. And we did a time and motion study, and it saved us 7 million clicks. So 7 million clicks received in 7 months after go live of time saved for our nurses.